all women with sexual dysfunction, they have features of more than one disorder. So it can be disorder of arousal and interest, it can be orgasmic disorder, and things like this. Female sexual disorders can be lifelong or acquired, can be situation-specific or generalized, mild, moderate, or severe, depends on the degree. So what are the cause of female sexual dysfunction? You cannot separate psychological or only physical factors, because sometimes psychological factors can cause physical change, as well as physical change can cause psychological factors as etiological in terms of etiology. So to list the psychological factors, it can be mood disorders such as depression or anxiety. Based on the previous experience, women can be affected with the psychosexual development due to past negative experience, including sexual trauma, emotional, physical, or sexual abuse during childhood or adolescence. So that might teach children to control themselves and hide emotions, so using defense mechanism. Early traumatic loss of a parent or another loved one also may inhibit intimacy with a sex partner for fear or similar loss. Concerns about negative outcome, such as unwanted pregnancy, sexually transmitted diseases acquiring, inability to have orgasm, things like this also can impair sexual response. Contextual causes. Here we talk about intrapersonal context, low sexual self-image, for example, relationship context, lack of trust, negative feelings, reduced attraction towards a sex partner. Sexual context, for example, surroundings that are not sufficiently erotic, private, or safe. Cultural context, restrictions on the sexual activities, things like this, due to culture specifications. Distractions and emotional stress from family, work, finances. So also can interfere with the sexual dysfunction, especially with the arousal part. And physical factors that can be genital or non-genital. Medications can seriously affect sexual function in females. The intake of alcohol, the intake of antidepressants, especially selective serotonin reuptake inhibitors, antihistamines, anti-seizure drugs, beta blockers, gonadotropin-releasing hormone agonists that literally cause iatrogenic menopause and hypoestrogenic states, oral contraceptives that also can shut down the production of the steroid hormones, and opioids. Physical factors, genital and non-genital. Genital factors, such as congenital malformations, for example, absence of the vagina, the syndrome of Rokitansky-Kushner. For example, vaginal septum, or clitoral hypertrophy, or it's a syndrome, Turner syndrome, when totally there is no female features. So things like this, number one factors for female sexual dysfunction. vaginal infections caused by specific or non-specific pathogenic microorganisms, genitourinary syndrome of menopause, ovarian insufficiency leading to hyperestrogenemia, bilateral oophorectomy, surgical menopause, vulvodermatosis such as lichen sclerosus, lichen planus, post-surgical scars, for example after episiotomy or after ruptures during delivery, radiation fibrosis also can be the cause of female sexual dysfunction. Among the non-genital factors, we need to list fatigue or any asthenic states, physical disabilities, hyperprolactinemia, including the breastfeeding period, hypertension, neuropathy or nerve damage due to diabetic, for example, neuropathy or multiple sclerosis, thyroid disorders, both hypo or hyper function condition, hypopituitary states, hypoadrenal states, and melanocyte stimulating hormone deficits. So hypoestrogenic states, when do we observe these states during the life of women? Of course, menopause, is whether it's timely, early, or premature. During ovarian insufficiency, so-called premature ovarian failure, or the syndrome of resistant ovaries, for example, also we would observe hypoestrogenic state.